What's the name of this instrument? This is Balfour's self-retaining abdominal wall retractor. The name is Balfour's self-retaining abdominal wall retractor. How to identify this instrument? See, in this instrument there is one horizontal bar. Can you see? So there is one horizontal bar. If you see, one blade is fixed. So at one end there is a fixed blade at one end, and there is a sliding blade. So this sliding blade is going to slide on this horizontal bar. So this is what? Sliding blade. So whenever we have to retract the cut edges of anterior abdominal wall, this sliding blade is used and it is going to retract the abdominal wall. If you see, there is a screw for third blade. In this horizontal bar, there is this screw for third blade. And if you see the shape of this third blade, the shape is like Doyne's retractor, and we discussed what is the use of Doyne's retractor. It is used for pelvic surgery. If we go only for abdominal surgeries, we use only these two blades. One is fixed and one is sliding. But if pelvic surgery is also being done, we are using the third blade. Okay, so this is Balfour's self-retaining abdominal wall retractor. The term is self-explanatory. Since it is abdominal wall retractor, it is used to retract the cut edges of anterior abdominal wall. So during gastrectomy, during hepatectomy, we are using this retractor. See the uses. So it is used to retract cut edges of anterior abdominal wall. Cut edges of anterior abdominal wall. In which surgeries? Generally in hepatectomy and gastrectomy. Hepatectomy and gastrectomy. What is the advantage of this instrument? That it is self-retaining. So if you have lesser number of people, lesser number of assistants, you can use this during hepatectomy and gastrectomy. And third blade, what's the use? Since it is like Doyne's retractor, so this third blade, it's used in pelvic surgeries. So imagine if a patient is having carcinoma rectum, we can use the third blade for APR and LAR. So third blade, it's used for pelvic surgeries. Generally LAR, low anterior resection, APR, abdominoperineal resection in carcinoma rectum. So these are the uses of Balfour's self-retaining abdominal wall retractor. This instrument was asked once in AIIMS. What's the name? This is Beckman-Whittlainer's retractor. Generally this retractor is used in ortho. How to identify? If you see, there are outward curving prongs, and when we are going to close the instrument, these outward curving prongs on closing, these are going to interdigitate. So these prongs are going to interdigitate. What are the uses of this Beckman's Whittlainer's retractor? So it is used to retract or hold back tissues or bone for exposure. So what's the use? It is used to retract or hold back tissues or bone for exposure. For exposure. Okay. So the name of this instrument is Beckman-Whittlainer's retractor. What's the name of this instrument? This is scapula retractor. So what's the use? It is going to retract the scapula during which surgery? During thoracotomy. How to identify? See, this instrument is having wide right angled blade. Can you see this? Wide right angled blade, and in this blade you can see that there is presence of fenestration. See the handle of this instrument. It is long stout handle. So there is long stout handle, wide right angled blade with fenestration. So we are going to retract scapula during thoracotomy. So name is scapula retractor. So it is used to retract scapula during thoracotomy. Retract scapula during thoracotomy. This instrument is Ellison lung retractor. How to identify? This instrument is having long curved cylindrical handle. Can you see there is long curved cylindrical handle. And if you see the blades, these blades are made of wires in the form of net. Can you see? This is the blade. Okay, and this blade is made of wires in the form of net. So the name is Ellison lung retractor. So generally it is used for retraction of the lungs. Whenever we are performing the surgery related to esophagus, in esophageal surgeries, we are using this instrument for retraction of esophagus also. So see the uses. So it is used for retraction of lungs, and since the blade is made of wires in the form of net, it prevents the damage of lungs during retraction. It prevents the damage of lungs during retraction. And in carcinoma esophagus, this instrument is used to retract the esophagus also. This instrument is bladder neck retractor. How to identify? You can see that there are two thin long blades, and if you see, there is presence of hook at the end. So here you can see two thin long blades and with presence of hook. What is the use? The term is self-explanatory. It is going to retract the bladder neck. So the use, it is used to retract the bladder neck. Obviously during which surgery? Bladder surgery. So what's the use? It retracts bladder neck during bladder surgery. So it retracts bladder neck. So name is bladder neck retractor, used for retraction of bladder neck. How to identify? Two thin long blades are there and there is hook at the end. So what are the clamps? Clamp presses two or more parts together to constrict or hold firmly. It presses two or more parts together to constrict or hold firmly. One by one we are going to discuss. First we are going to discuss the intestinal occlusion clamp. So there is Doyne's intestinal occlusion clamp and there is Peyer's crushing clamp. What's the name of this instrument? This is Doyne's intestinal occlusion clamp. This is non-crushing. Okay, see the important points and how we identify this instrument. First, see, it's having flat, thin and springy blade. What kind of flat, thin and springy blade? We discussed that in clamp, what kind of serrations are there? So in clamp, there is presence of longitudinal serrations. So here also you can see that there is presence of longitudinal serrations. This is non-crushing. Okay, so what kind of serrations? Superficial, longitudinal and superficial serrations. One feature. Second, if you notice it carefully, between the blades there is slight concavity and there is gap. So between the blades, if there is gap and we are going to clamp the intestine is going to bulge between the blades. Clear? So there is slight concavity and gap to allow bulging of bowel when we are going to clamp the intestine. Now what is the use? This is non-crushing. So we are using this instrument during resection and anastomosis. Why? To clamp the intestine. So whenever we are going to clamp the intestine, it prevents the spillage of intestinal content. So what's the use of Doyne's intestinal occlusion clamp? It clamps the intestine to prevent spillage of content. To prevent spillage of intestinal content. Okay, so it is used to clamp the intestine to prevent spillage of intestinal content. This is non-crushing. An important point, it is having superficial serrations. There is concavity and gap between the blades. What's the name of this instrument? This is Peyer's crushing clamp. It is crushing clamp. It is a clamp. So what kind of serrations will be there? Longitudinal, you can see, and it is crushing. So here you can see there is presence of deep longitudinal serrations. It is a heavy instrument and you can see there is stout handle. It works on double lever mechanism. So what's that double lever mechanism? See, this is the first lever here. So the first lever, it opposes the blade firmly, and there is second lever, it is going to multiply the exerted pressure. So it works on double lever mechanism. Double lever mechanism. Okay, first lever opposes the blade firmly and the second lever multiplies exerted pressure. Another important point which was not there in Doyne's intestinal occlusion clamp. Here you can see that there is presence of tooth at end. So there is presence of tooth and groove at end. And if there is presence of tooth and groove, it is going to lock the blade fully. So it locks blade fully. So there is no slippage. It locks the blade fully. So the name is crushing clamp. Okay, so it crushes the bowel. So it is used in resection and anastomosis of bowel, and second, it is used in gastrectomy also. So what are the uses? So it is used in resection and anastomosis, RA, resection and anastomosis of bowel, and Peyer's crushing clamp is also used in gastrectomy. Nowadays, vascular clamps are also asked. One is Light's bulldog clamp, one is Potts bulldog clamp, and third, which is frequently asked, that is Satinsky vascular clamp. So one by one we are going to discuss the vascular clamps. First, see Light's bulldog clamp. It's a type of vascular clamp, Light's bulldog clamp. So it's a vascular clamp. It is used for temporary occlusion of small blood vessels. How to identify? See, in this instrument there is pinch cock action. So if you press it, the instrument is going to open, and if you release the pressure, it is going to close. So what will happen? There is blood vessel, and if we are going to apply, it is going to cause the temporary occlusion of blood vessels. Now see the inner aspect of the instrument. There is presence of fine transverse serrations. Can you see here? Presence of fine transverse serrations. So what is the use of this Light's bulldog clamp? It is used for temporary occlusion of small blood vessels. Okay. So there is pinch cock action. This pinch cock action differentiates it from Potts bulldog clamp. So if you see this Potts bulldog clamp, here you can see that there is spring loaded handle. The serrations are similar to Light's bulldog clamp, and the use is also similar. It is also used for temporary occlusion of small blood vessels. So difference, here you can see that in Light's bulldog clamp there is pinch cock action, and in this Potts bulldog clamp there is spring loaded handle. So if you have seen a paper clip, it is looking like paper clip. So this is paper clip instrument used for temporary occlusion of small blood vessels. This is Satinsky vascular clamp. And what is the use of this Satinsky vascular clamp? This is used for partial occlusion of large blood vessels or its branches like inferior vena cava, superior vena cava, or aorta. How to identify this instrument? See, if you see, there are multiple angulations in this instrument. Can you see? Multiple angulations. And if we see the inner aspect of this instrument, can you see there is presence of vertical groove, and what? There is presence of fine transverse serrations. So there is vertical groove, fine transverse serrations, and multiple angulations. What is the use of this instrument? Partial occlusion. It is used for partial occlusion of large blood vessels like inferior vena cava, superior vena cava, and aorta. So partial occlusion of large blood vessels and its branches. Whenever we are using this Satinsky vascular clamp, when we are going to apply, so if you see, we are going to cause the partial occlusion of this larger blood vessel, and from rest of the lumen, blood flow is continued. So blood flow is maintained from the rest of lumen, and this is used for partial occlusion. So whenever some kind of tear is there, some kind of injury is there, with the use of this Satinsky vascular clamp, we can repair the site of tear or injury. So it's used for partial occlusion of large blood vessels and its branches. Name is Satinsky vascular clamp. Now we are going to discuss scissors. So you can see this is Mayo scissors. This is long and stout. And this Mayo scissors is used to cut the sutures. Apart from cutting suture, it is used for cutting the tough structures like sheath, aponeurosis, linea alba ligaments. So Mayo scissors, it is long and stout. And what are the uses? Uses of Mayo scissors. First, we use these scissors to cut sutures. So it is used to cut sutures. And second, it is used to cut tough structures. It is used to cut tough structures. So we use Mayo scissor to cut linea alba, aponeurosis, sheath and ligaments. This is Metzenbaum scissors. If you compare this scissors with Mayo scissors, you will find that this is lighter than Mayo's. Second thing, here you can see that there is long shaft and short blade. Long shaft, short blade, and it is lighter than Mayo's. This is used to cut delicate structures like bladder and bowel. And this scissors is used for fine dissection. Okay, so what's the name? Metzenbaum scissors. See the uses. So it is used for fine dissections. It is used for fine dissections, and it is used to cut delicate structures. So this scissors is used to cut delicate structures. So you have seen we use Metzenbaum scissors to open peritoneum, to dissect the sac from cord during hernia surgery, and whenever we are performing resection and anastomosis, this Metzenbaum scissors are used to cut the intestine. So name is Metzenbaum scissors, and it is used for fine dissections and to cut the delicate structures. What is the name of this scissors? There was an image based questions in AIIMS related to the scissors. So the name is Lister bandage scissors. So if the name is Lister bandage scissors, what's the use? So this scissors is used to cut the bandages. So how to identify this scissor? If you see the upper blade in this scissor, it is bent, and if you see the lower blade, it is flat, blunt. So lower blade, can you see this? This is flat and blunt, and if you see, there is presence of a non-traumatic tip. So there is bent upper blade and there is flat, blunt lower blade with non-traumatic tip, and this scissors are used to cut the bandages. In the OT you have seen. So what's the use of Lister bandage scissors? It is used to cut the bandages. So the term is self-explanatory. It is used to cut the bandages. See, what's the name of this instrument? This is tracheal dilator. So what is the use of dilator? Dilator is going to enlarge any opening in progressive manner. What is dilator? Dilator is going to enlarge any opening in progressive manner. So this is tracheal dilator. So obviously this is used to dilate the trachea. Generally, in which surgeries we are using the tracheal dilator? The term is self-explanatory. It is used to dilate trachea in tracheostomy. And second, we are using this instrument whenever we are changing the tracheostomy tube. Now, trachea. To avoid the injury of mucosa of trachea, if you see in this instrument, there is olive pointed, blunt, smooth tip. What kind of tip you can see here? Olive pointed, blunt, smooth tip. Why? To avoid injury of tracheal mucosa. Injury of tracheal mucosa. Okay. So how to identify this instrument? There is olive pointed, blunt, smooth tip, and second important feature that there is gently curved blade. So what are the uses of tracheal dilator we discussed? So it is used during tracheostomy to dilate trachea. Used during tracheostomy to dilate trachea, and it helps in reinsertion of tracheostomy tube. So these are the uses of tracheal dilator. These are urethral dilators. So the name is urethral dilator. So obviously it is used to dilate the urethra. When we are going to dilate the urethra, when the patient is having stricture. So if patient is having stricture urethra, we can dilate the urethra in that situation. And second, before performing cystoscopy, we dilate the urethra with urethral dilators. So what's the use of this urethral dilator? It is used to dilate urethra. Dilate urethra. If patient is having stricture, or if we are planning to perform cystoscopy. So before cystoscopy. So these are the uses of urethral dilators. What's the name of this dilator? This is Bake's bile duct dilator. So here the term is self-explanatory that these dilators are used to dilate the bile duct. How to identify these dilators? If you see, you can see that in Bake's bile duct dilator there is narrow stem, and you see there is oval solid tip. Narrow stem, oval solid tip. So it is used to dilate the bile duct. So in which situations we are going to dilate the bile duct? See the uses. So what are the uses? In choledochotomy, we have to dilate the bile duct after removal of stone. We have to perform sounding of bile duct, and we want to check whether there is any retained stone or not. And third, this instrument is used to check the patency of ampulla of Vater. So it is Bake's bile duct dilator. See this instrument, what's the name? If you have seen ice cream scoop, the end is like that. So the name is Volkmann scoop. How to identify this instrument? You see here, there is handle with serrations. So for better grip, there is presence of serrations in the handle. And if you see the end, here you can see that there is sharp-edged, curved and spoon-like trough. And this spoon-like trough, it helps in scooping or curettage. So see what are the uses of Volkmann scoop. So Volkmann scoop is used for debriding the contents of abscess cavity, sinus, fistula, and it is also used in collection of cancellous bone graft. So uses, it is used in debriding the contents of abscess cavity, sinus, fistula. Why? Because there is spoon-like trough, curved spoon-like trough. And the second use, it is used for the collection of cancellous bone graft. So the name of this instrument is Volkmann scoop, and it is used in scooping or curettage. This is another scoop, and if you see, the both ends are having spoon-shaped tip. Can you see? Both ends are having spoon-shaped tip. And what's the name? Name is gallstone scoop. So if the name is gallstone scoop, so it is used to scoop or remove the gallstone from the gallbladder. So what's the name? Here you can see that there is spoon-shaped tip. So what's the name? Name is gallstone scoop. So what's the use? It is used to remove gallstone from gallbladder. Remove gallstone from gallbladder. So generally during cholecystectomy, whenever it's difficult to extract the gallbladder, this scoop is used for removing the gallstone. Now we are going to discuss the laparoscopic instruments, and this is Wierie's needle. This needle was asked many times in AIIMS and NEET. So what is the use of this Wierie's needle? We already discussed that this needle is used to create pneumoperitoneum, and by which method it is used to create pneumoperitoneum? By closed method. Wierie's needle, it is used to create pneumoperitoneum, and by which method? That's known as closed method. There is another method of creating pneumoperitoneum, that is open method, in which we have to insert the Hussen's cannula for creating the pneumoperitoneum. By Wierie's needle, if pneumoperitoneum is created, it's known as closed method. This is closed method. Okay. How to identify this instrument? It's very easy. Here you can see that there is a sharp tipped needle, and you can see there is blunt tipped obturator. So in this, there is sharp tipped needle and blunt tipped obturator. Now see how it works. This sharp tipped needle is going to penetrate the abdominal wall, and when it is going to penetrate the abdominal wall, the resistance is lost. Resistance is lost. Okay. And when the resistance is lost, what happens? This blunt tipped obturator, it springs forward to prevent any iatrogenic injury. So sharp tipped needle penetrates the abdominal wall, resistance is lost, and then blunt tipped obturator springs forward to prevent any iatrogenic injury. Second important point related to Vere's needle, that how we check the intraperitoneal position of Vere's needle. Suppose you have to insert the Vere's needle, we have to check whether it is in the intraperitoneal cavity or not. So this is checked by saline drop test. How we do this saline drop test? Have a look. How we perform this saline drop test? We have to attach a syringe with saline to the Vere's needle. First we have to aspirate. After aspiration we have to remove the plunger. In the syringe still saline is there. After removing plunger, if there is free flow of saline, it suggests that the Vere's needle is in the intraperitoneal cavity. So Vere's needle is in the peritoneal cavity and it is checked by saline drop test. So see again how it's done. We have to attach a syringe with saline to Vere's needle. We aspirate. After that we have to remove the plunger of syringe and observe for free flow of saline into peritoneal cavity. If there is free flow of saline into peritoneal cavity, it suggests intraperitoneal location of Vere's needle. So it suggests intraperitoneal location of Vere's needle, and the name of this test, it is saline drop test. What's the name of this instrument? This is Hassan's cannula, and we discussed that it is also used to create pneumoperitoneum. By which method? Open method. So it is used to create pneumoperitoneum by open method, Hassan cannula. So in which patients this Hassan cannula is used for creation of pneumoperitoneum? Imagine if the patient is having previously upper abdominal surgery. Because of this, there might be adhesions. Second, if the patient is having ileus and there is distended bowel loops, so in these patients, we create pneumoperitoneum by open method and we use Hassan cannula. So in which patients we are using? It is used in patients who are having, there is history of upper abdominal surgery, or if the patient is having ileus. What is the advantage of Hassan cannula over the Vere's needle for creating pneumoperitoneum? With Vere's needle, we might injure the blood vessels. But with Hassan cannula, since pneumoperitoneum is created under direct vision, there are lesser chances of vascular injury. So what's the advantage? Advantage that with this method, there are less chances of vascular injury. So there are less chances of vascular injury. Clear? So what's the name of this instrument? This is Hassan's cannula, used for creation of pneumoperitoneum by open method. What is the name of this instrument? This is trocar, another instrument used in laparoscopic surgery, and this was an image-based question in AIIMS. See, in this trocar, there is an obturator, and if you see this obturator, it is having pyramidal cutting tip. So this is having pyramidal cutting tip. Why? Because it is going to pierce the muscle and rectus sheath. So this pyramidal cutting tip of obturator, it pierces muscle and rectus sheath. Clear? So what's the use of this trocar? First, it is going to access the peritoneal cavity, and second, you have seen that it is going to maintain pneumoperitoneum when instruments are getting changed. So what are the uses of trocar? First, it is used to access peritoneal cavity. It is used to access peritoneal cavity. Okay. And second, it maintains pneumoperitoneum. Maintains pneumoperitoneum when instruments are getting exchanged. So this is trocar. What's the name of this instrument used in laparoscopy? This is laparoscope. Laparoscope. First question which is asked related to this laparoscope, that it is based on which optical system? It is based on Hopkins optical system. First question, it is based on Hopkins optical system. Okay. Second, if you have seen laparoscopic surgery, why we use laparoscope? First, it is going to visualize the contents, peritoneal cavity. So it is used for visualization because it is attached to camera. And second, it helps in magnification. So what's the use? Laparoscope, it provides visualization and very important, magnification. Visualization and magnification. Clear? Now see what are the types. It is of two types. You can see here, see the end. This is oblique viewing. So if the angle is 30 degree, 45 degree, 60 degree, this is oblique viewing. And if the angle is 0 degree, it means it is flat. So this is end viewing. What are the types? It's of two types. First, end viewing. So in end viewing, the angle is 0 degree. And there is oblique viewing laparoscope. In oblique viewing, what are the angles? 30 degree, 45 degree, 60 degree. So which laparoscope is having larger field of vision? So the laparoscopes which are oblique viewing, those are having larger field of vision, and that's why oblique viewing laparoscopes are preferred. So which are preferred? Oblique viewing. Why? Because these are having larger field of vision. Okay. See, in this laparoscope, this is the place where we are going to attach the camera. So there is coupler, we have to attach the camera, and here we are going to attach the light source. So here you can see light source is attached here, and we are going to attach camera. So this is laparoscope. There are two types. One is end viewing and one is oblique viewing. Oblique viewing laparoscopes are preferred, and you have to remember it is based on Hopkins optical system. Now see other instruments which are used in laparoscopy. Commonly used instrument for dissection is Maryland dissector, and there is another blunt dissector which is used commonly in laparoscopy. Maryland dissector and blunt dissector. If you have seen laparoscopic cholecystectomy, there is a strong instrument which is used for extraction of gallbladder, and that is what? Alligator forceps. So Maryland dissector, blunt dissector, these are used for dissection, and this alligator forceps, it is used for extraction of gallbladder. Extraction of gallbladder during laparoscopic cholecystectomy. If you see this instrument, the terminal part of instrument is at the right angle to rest of the blade. So the terminal part is at right angle to the rest of blade. So what should be the name of this instrument? This is right angle dissector. So just like right angle forceps, what? The functions are similar. So this is right angle dissector. See this instrument. Here there is fenestration. You can see that there is curved tip. And if it is going to be closed, what? There is space between the two blades. So between two blades at tip there is space. This is a non-traumatic instrument. It looks like Babcock's forceps. So this is Babcock's forceps. Can you see? This is another forceps in which you can see the fenestration. Between the blades there is fenestration. So what's the name? This is fenestrated forceps. So these are the commonly used instruments during laparoscopy. What's the name of this instrument? This is skin stapler. You have seen the paper stapler. So it is like that. This is skin stapler, and it is used for stapling or closing the skin incision. Stapling or closing the skin incision. You have used that paper stapler. In that you have seen that there is staples or cartridge. So in this also you can see there is presence of staples or cartridges. Whenever a patient is having longer incision, so this is the fastest method to close the skin incision, and we use what? Skin stapler. So here you can see how these are being applied. You can see here. So skin stapler, it is used for stapling or closing the skin incision, and this is the fastest method. It's the fastest method to close long skin incision. Fastest method to close long skin incision. This is skin stapler. There are two suction cannulas which are frequently used in general surgery. One is Yancour's suction cannula and the second is Adson's suction cannula. Yancour's is used to suck the large volumes of blood fluid. So whenever we are going to perform the peritoneal lavage, if the patient is having hemoperitoneum, in those cases we are using Yancour's suction cannula. And if some fine meticulous surgery is being performed, we use Adson's suction cannula because it's having fine tip. One by one we are going to discuss. See first the Yancour's suction cannula. How to identify? So if you see, there is blunt, smooth, rounded tip. What kind of tip? Blunt, smooth, rounded tip. You can see here. Simultaneously, it is having three holes. So there is one main hole and there are two side holes. How many holes? There are three holes, one main hole and there are two side holes. If you see, it is having angulated body. So what is the advantage of having angulated body? That this angulated body is not going to obstruct the surgeon's field of vision. So it doesn't obstruct. It doesn't obstruct the surgeon's field of vision. Okay, so whenever we have to suck large volume of fluid or blood from the peritoneal cavity, it is used. So generally it is used for peritoneal lavage. Peritoneal lavage. Okay, so in which patients generally we perform peritoneal lavage? You have seen in emergency patients who are having perforation peritonitis and the patients who are having hemoperitoneum. Hemoperitoneum. So when large volume of blood or fluid has to be sucked out, this Yancour's suction cannula is used. See the second one, this is Adson's suction cannula. How to identify? Here you can see that there is a vent with thumb rest. Okay, and this vent with thumb rest, it gives better control of suction cannula. So this is for better control of suction cannula. In this also you can see that there is slight angulation, and if you see the tip, there is fine suction tip. So if there is fine suction tip, this Adson's suction cannula is used for fine and meticulous surgery. So you can see the comparison. There is fine suction tip and that's why it is used for fine and meticulous surgery. Adson's suction cannula. So it is used in fine and meticulous surgery, like we are using it in plastic surgery, in reconstructive surgery and in vascular surgery. Plastic surgery, in reconstructive surgery and vascular surgery. So the name of this suction cannula is Adson's suction cannula and the first one was Yancour's suction cannula. Now we are going to discuss the principles of diathermy or electrosurgery. So see, whenever electric current passes through any conductor, some of its energy appears as heat. So whenever electric current passes through any conductor, some of its energy appears as heat. So in this, the heat produced depends upon intensity of current. What? First, intensity. Second, waveform of current and electrical property of tissue. Which tissue? The tissue through which electric current passes, and relative sizes of electrode. So in diathermy or electrosurgery, see, the heat produced depends on intensity of current, waveform, electrical property of tissues and relative sizes of electrodes. There are two types of electrosurgery, also known as electrocautery. One is monopolar and the second is bipolar. Why monopolar is called monopolar? Because there is single active electrode, and in bipolar cautery or electrosurgery there are two active electrodes. So what are the types? So there is monopolar cautery or diathermy, and this is bipolar cautery or bipolar diathermy. Okay, here you can see This is the electrosurgical unit. So there is electrosurgical unit. Now see what are the differences. In monopolar cautery, there is a single, mono means single. So there is single active electrode. This is active electrode. Single active electrode. Okay. Whereas in the bipolar dithermy or cautery, you can see these are two active electrodes. So both are active electrodes. One is known as active and second is return electrode. So in monopolar cautery, there is single active electrode, and in the bipolar cautery, there are two active electrodes. In detail, we are going to discuss. First, we are going to discuss the monopolar dithermy. Now see monopolar dithermy, how it works. We discussed that there is single active electrode. If we compare monopolar from bipolar cautery, out of these two, which one is most commonly used? So it's the monopolar cautery or dithermy which is most commonly used. In this case, there is active electrode and return electrode. You have seen in the OT that there is a cautery pad, black colored cautery pad which is applied over back, gluteal region or near thigh. That is returned electrode. So here you can see that there is return electrode applied here. So this is return electrode. Okay. And you can see that this is active electrode. Now see how it works. There is active cable and there is a return cable. From the active cable, alternating current is going to the active electrode. Active electrode is just like the pen. Okay, so here there is a tip and there is a small surface area. So here you can see how it looks like. There is small surface area. Okay, so there is small surface area of this active electrode. So whenever alternating current reaches the small area of active electrode here, the electric current is concentrated. And since there is concentrated electric current, it is going to produce the heat. And this heat is used for cutting and coagulation. So which button is used for coagulation? Can you see here? This is the blue button. It is used for coagulation. Which button is used for cutting? So yellow button, it is used for cutting. How to remember? Mnemonic is blue co. Just remember this. Blue co. Blue for coagulation. Blue co. Now come back here. So see here, active electrode is having small surface area. So here, concentrated electric current. Because of concentrated electric current, what is produced? It is going to produce heat. And this heat is used for cutting and coagulation. So this is the heat which is used for cutting and coagulation. So in the cautery, there is button, blue co. Blue is used for coagulation, yellow for cutting. See, via the return electrode, the alternating current is returned to the return cable. So via return electrode, alternating current is going to return cable and then it is going back to the electrosurgical unit. So how it works? Via active cable, alternating current goes to active electrode. Electric current is concentrated, so it is going to produce heat. Heat is used for cutting and coagulation. Via return electrode, the alternating current is going to the return cable, and via return cable, it is going back to the electrosurgical unit. So how it looks like? This was an image-based question in AIIMS and NEET. So see how this monopolar dithermy or cautery looks like. So there are two buttons. Blue button is for coagulation and yellow button is used for cutting. Now see how bipolar dithermy works. So we discussed that this is the electrode. In bipolar dithermy, there are two active electrodes. So via active cable, the alternating current is going to the active electrode. And see, if the tissue is caught between these electrodes, what happens? There is local flow of current. So whatever the tissue is caught, it gets heated and it gets burnt. And then the current passes or it goes to the return electrode. So this is bipolar cautery. So what's the advantage of this bipolar cautery or dithermy? When some tissue is being caught between the electrodes, what? Surrounding tissues are being spared from being heated up or having current passed through them. So this is the advantage of bipolar cautery or dithermy. You have seen that generally this bipolar dithermy, it is used in gynecological surgery. Generally it is used in gynecological surgery. So how many electrodes? 2 electrodes, and both of these are active electrodes. One is known as active, one is known as return. When the tissue is being caught up between the electrodes, it gets heated and it gets burnt, but surrounding areas are spared. So this is bipolar cautery, and this is how it looks. See the effects of diathermy. There was one question related to effects of diathermy in AIIMS. So effects of diathermy or cautery. So see, it can lead to coagulation, and the coagulation is activated by intermittent waveform. Two things we discussed, mainly cutting and coagulation. So coagulation is activated by intermittent waveform, and this cutting is activated by constant waveform. This was the question in AIIMS. So coagulation activated by intermittent waveform, and cutting, it is activated by constant waveform. What is fulguration? In fulguration, there is destructive coagulation and charring. Fulguration, in that there is destructive coagulation and charring. What is blended waveform? Blended waveform. So the blended waveform is having advantage of both cutting and coagulation. So let's revise it quickly because it's important. Coagulation is activated by intermittent waveform. Cutting is activated by constant waveform. Fulguration is destructive coagulation and charring. And what is the advantage of blended waveform? That it is advantage of having both cutting and coagulation. So these are the effects of diathermy. There was one question related to capacitance coupling in UPSC. So it is known as capacitance coupling, also known as capacitive coupling, also known as coupling capacitance. What are the names? So it is known as capacitance coupling, capacitive coupling, or coupling capacitance. So see what happens here. There are two predisposing factors. First, suppose, what are the predisposing factors? Here you can see there is diathermy hook. If we use high frequency alternating current, first, the use of high frequency alternating current, and second, in this instrument, if there is thin insulation layer. So what's the problem? There is thin insulation layer. So the two predisposing factors are, first, high frequency alternating current, and second, there is thin insulation layer. So if you use metal laparoscopic port, so what? This is a conductor because it's metallic. So what happens? There is transfer of energy to a nearby conductor. I'm repeating, two predisposing factors, high frequency alternating current, and there is thin insulation layer. Because of that, there is transfer of energy. There is transfer of energy to a nearby conductor, if it's metallic obviously. So whenever this port or this conductor, it comes in contact with bowel, or it is going to touch a nearby bowel. So at the point of contact with bowel, there is stray current injury. So at the point of contact with bowel, there is stray current injury, and this is known as capacitance coupling or capacitive coupling. So high frequency alternating current, if there is thin insulation layer, there is transfer of energy to a nearby conductor. When this conductor comes in contact with bowel, there is stray current injury. This is known as capacitance coupling. Easiest way to avoid this capacitance coupling, easiest way, convert this metallic laparoscopic port to plastic port. So if we use plastic laparoscopic port instead of metallic port, we can avoid capacitance coupling. So how to avoid? Use of plastic port. Use of plastic port can avoid the capacitance coupling. What is the name of this instrument? This was also asked in AIIMS in the form of image based question. So this is electrothermal bipolar tissue sealing system known as LigaSure. So this is electrothermal bipolar tissue sealing system. Bipolar tissue sealing system. Okay. If you have seen the laparoscopic surgeries, in laparoscopic surgeries, we are using this LigaSure. Generally, it is used in both abdominal and pelvic surgery. So see, it is used in laparoscopic, abdominal as well as pelvic surgeries. Used in laparoscopic, abdominal and pelvic surgery. So in these surgeries, it is mainly used to seal the vessels up to 7 mm in diameter. So it is mainly used to seal the vessels up to 7 mm in diameter. And you can't believe within how many seconds it is going to seal the vessels. It is going to seal the vessels within 2 to 4 seconds. So what are the uses? Uses, it is going to seal the vessels. Seal the vessels. The question which is asked, that up to what diameter? The diameter is up to 7 mm. And within how many seconds it is going to seal these vessels? It can seal these vessels within 2 to 4 seconds. So within 2 to 4 seconds, it can seal vessels up to 7 mm in diameter. So you have to remember the diameter 7 mm. Apart from vessels, it can seal tissue bundles also and lymphatics. So apart from the vessels, it can seal pedicles of organ, tissue bundles and lymphatics. Tissue bundles and lymphatics. So what is the advantage of LigaSure? That there is minimal lateral thermal spread. It improves vessel sealing with minimal lateral thermal spread. So what's the advantage of LigaSure? That it improves vessel sealing, improves vessel sealing with minimal lateral thermal spread. There is minimal lateral thermal spread. Okay. So what are the questions which you have to remember related to LigaSure? First, that it can seal the vessels, pedicle, tissue bundle, lymphatics. The size of vessels which can be sealed, the diameter is up to 7 mm, and within how many seconds it can seal the vessels? 2 to 4 seconds. What's the name of this instrument? This is harmonic scalpel. Yes, this instrument is based on ultrasound technology. Important point. So the name is harmonic scalpel and it is based on ultrasound technology. Clear? And see, with use of ultrasound technology, it is used to cut, simultaneously seal the tissues. So it is going to cut, simultaneously it is going to seal the tissues. Clear? So what happens here? You can see there is active jaw and there is inactive jaw. So the scalpel is going to vibrate at 20,000 to 50,000 Hz. And here this vibration is responsible for denaturation of protein. It's not the heat, it's the vibration which is responsible for denaturation of protein. So see here, scalpel vibrates. This frequency is asked in exam. The scalpel vibrates at 20,000 to 50,000 Hz. Clear? And because of this vibration, what happens? This vibration is responsible for protein denaturation. Right? So it's not the heat, it's this vibration which is responsible for protein denaturation. This harmonic scalpel can divide both arteries and veins up to 7 mm in diameter. So see what are the uses? Uses of harmonic scalpel, that it divides both artery as well as vein up to what diameter? We discussed that for LigaSure also the vessels which were sealed was up to 7 mm, and here also the diameter is up to 7 mm. So what are the advantages of using harmonic scalpel? There is less thermal damage to adjacent tissues. There is less charring, desiccation. There is reduced operative time. So since there is less charring, less desiccation, reduced operative time, and that's why if we use harmonic scalpel, there is faster recovery. So this is all about instruments.